Well, good morning, ladies and gentlemen. It's a pleasure to be here in Cornwall. It's good to see that we've got some nice flood weather with us today and probably building up over the next week or so. I'm going to be reviewing from a kind of academic standpoint various reports that have been done on how people perceive flood risk and then considering barriers to resilience. Some of these are based up where I'm from, around Portsmouth. Similar problems around Portsmouth and the Isle of Wight to what you might have, what you do have around Cornwall and Devon, with both coastal and fluvial and flash flood issues to deal with. Probably not quite such a wild and windy landscape as you've got down here that we have to deal with up around the Solent. Also with Portsmouth, it's one of a handful of cities in the UK that for many years has been recognised as being particularly susceptible, particularly at risk to flooding. And just in the last few years, they've begun to spend a lot of money on coastal defences. You can see some of those new works going in around Southsea Castle there, as part also integrated into a promenade, so it can help with the tourism. So both the defence and the local economy benefiting in more ways than one through that new promenade feature. But of course, hard defences are only one side to that problem, and a key aspect otherwise then is going to be the flood resilience, the community resilience. So what I first of all wanted to do was just consider ways in which risk is perceived, and it's very complicated, many factors. We can look on the main drivers of risk, and that then is features which are exposed to hazards, flood hazards, and are also exposed, vulnerable to flooding, and then consider as well the resilience to the ensuing impacts, the coping capacity, if you want. So you get an intersection of the actual hazard from flooding, how severe, how frequent, and unfortunately with climate change and global heating, then that is getting worse. More storms, bigger storms, more frequent. We're seeing that. Then you've got the degree of exposure, that the people exposed, how well the early warning systems work. You've got the vulnerability, very much the community side, the demographics, the levels of poverty, issues right the way through to insurance as well. How well have you got insurance? I haven't got insurance. How easy is it to get that? And then the resilience side coming in very much after we've had the event. We have preparedness for an event, the response to the event. How have you coped is very much how good is your resilience? How good is your coping capacity? So that's a kind of a theoretical framework that I hope gives you an idea of how many of these factors are then interacting, and then the importance of effective management too. If we can, one of the key things I work on is trying to A, identify the hazard, but then B, try and reduce the vulnerability. If you can reduce the hazard and the vulnerability, the degree of exposure, then the overall risk of a disastrous event occurring is going to be reduced. So what I've done, there's only so much I can talk about in the next 10 minutes or so, is I've taken a number of master's projects. There's probably a dozen or so universities that will often offer master's courses in things like crisis management, emergency management, risk and resilience management. Portsmouth offers a few of these. And what I've got is I'm lucky to have a pool of student dissertations at master's level, often sponsored, some of them by either the Environment Agency or by emergency management agencies. We've had quite a few from the Fire and Rescue Service in recent years. Some of them military people coming in as well, who want to retrain. Maybe they're leaving and want to retrain in different areas, or maybe they want to develop skills that might be used from the military side. And these I've got listed here. First one is from somebody who's focused on Cornwall. That's Judith. You might know her. She's reviewed flood risk perception and volunteer flood warden recruitment. Another one, Eleanor Stanfield, 2022, on the Isle of Wight. A large number of the people interviewed there were mainly over 65, many pensioners. So there's an interesting contrast comparing the older demography there versus the younger people on the island. A review that was done for the Hampshire and Isle of Wight Local Resilience Forum, looking at public perceptions of flood risk, preparedness, and then the types of alerts that were most effective, that people found they would respond to most easily. Another study that considered school preparedness for a major flood event by Sam Mundell, and then Olivia Mansell working up in Southeast Yorkshire on the coast there on perceptions of individual flood resilience and then barriers to community risk management. And then on top of that, I've looked at the recent report from the British Red Cross, which looked at flood preparedness, the impact and recovery in socioeconomically disadvantaged communities. So there's a specific focus then on the people that were interviewed, a bit of detail about that, from communities where there was a very high proportion who were in one of the areas of very high socioeconomic deprivation. And they did a study, one case study from England, one from Scotland, one from Wales, one from Northern Ireland. Two of those were urban communities, one of them was rural, and one of them was mixed rural and urban. So I think that gives us an overview, if you want, of the UK. It's not going to be definitive, but it's hopefully going to give you a few things that might be well worth discussing and considering. The flood risk perceptions, these can be, as we've heard from the first talk, very much based on individually and family as to what might happen, or maybe you haven't thought that yet. You haven't yet had the what if situation where you're thinking how you or your family might be affected. Another aspect is business and business continuity, particularly important. A lot of campaigns come out now. Most resilience forums will have a business section telling business to think about particularly where do they store all their company documents. And if they're in a flood zone, make sure it's not on the ground floor, it's well up on the second floor if you've got one or third floor, in somewhere where those documents can easily be retrieved, for instance. And then we're into community and maybe district level considerations. And that brings us as well into the idea of sense of community. And we've got various academic theories which link to that. There's also a sense of place, and there's the importance of being a resident and having local knowledge. Very often, people most at risk are those that are not resident. Now, that could be tourists, but in some situations where I've worked out in different countries, you've got people that have moved in. Maybe they've been displaced from one area and they're new into an area. And sometimes when you look at major incidents like, say, a tsunami, 70 or 80% of the fatalities are with the people who are the newcomers who don't know how to respond, where to go to in the event of a major disaster event. And experience, past experience, very important. We'll look at that a bit later, but in many cases, once you've experienced it, yes, okay, you know what the situation is, you know what you should be doing, you know what you should be preparing for. But if you don't have that, then very often you can be very much caught out by a particular hazard event. So this is just some of the data from one of the subjects there, then looking at the perceived risk based on the length in which somebody's lived in an area versus the actual effectiveness of their response. You know, the longer you've lived in an area, the better prepared you are to respond to the particular hazards that affect that area. Predictable, but this is just where we're going out and doing samples of anything from 20 odd to 300 odd people to see what they think. From the Red Cross survey, this was what I mentioned before. Of those that were more aware and more prepared, those were the ones that actually had past, because they'd had the experience, they were more prepared about what they should do. Note that they also said they also had to seek out themselves a lot of the information. There was a bit of a communication barrier in finding the information that they needed. Okay. And in terms of flood perception and the various types of flood perception get by personal vulnerability, having that previous flood experience and awareness, very important. It varies considerably then. It's particularly important in terms of the very young or the very old, where there are mobility and awareness issues. Another key factor is the stress that comes with flood events, and therefore an emotional coping capacity and aspects of mental health. And then there's the other thing that's very important in terms of coping is social capital, and that's the support of family and friends, either having that support or being isolated and alone. And we don't want people in the isolated and alone category. Another key aspect then is socioeconomic status, whether you've actually have got the financial resources to cope with the situation you find yourself in, if you've just lost your home, or if you're having very rapidly to try and find the funds to cope, but there's a lag before you can find those funds. The situation is very different as well if you're a house owner versus you're renting. If you're renting, or in social housing, very often you've not got much control over what happens next, and it's can be much more difficult to get rehoused in the same neighbourhood, in the same community. And the other issue then, as I mentioned, is insurance, whether you've got levels of insurance or not. If you haven't got insurance, it's obviously far more devastating, but can you afford the insurance? And from the Red Cross survey, there was a general dissatisfaction. This is very much focused on the areas with higher socioeconomic deprivation, but a widespread dissatisfaction with the rehousing that occurred after a flood event. We can think of the management for flood risk in terms of the different stages you go through. There can be the preparedness stage before the flood occurs, the response phase, actually what happens during the flood, where time is moving really, really quickly. You've got to get very rapid responses. I deal a lot with finding the information to get the situational awareness to inform search and rescue teams as to the areas to focus on. I do a lot of work as well with preparedness, but I've got many weeks or months to get the preparedness mapping done that highlight the areas where you've got your floodplain, or where you've got the critical infrastructure, or where you've got your main centres of population, particularly those which have got the higher levels of socioeconomic deprivation. So you've a long time to do the preparedness. You've got to respond very quickly. And then there's also the recovery phase, which is very often forgotten at higher levels with the planning. And in terms of preparedness, it's interesting then to look at some of the motivators and then the deterrents. And this was a study that was done up in Yorkshire. Key motivator: protecting your family, protecting your house, your property, and whether or not you've got previous experience. And in terms of deterrents, not enough clear information, the cost of it, can't afford it, and then not enough time. That relates back to preparedness in some ways. If you were prepared beforehand, you'd have more time during the actual event. Trust in local authority. Generally, the action, if you trusted the local authority, the action tended to be more effective. Other things about features with the hubs as well, with community hubs, sometimes that they can be well prepared, but sometimes some aspects, some parts of the community are not well catered for. So it just needs a more thorough analysis and assessment, maybe some drills and practices to make sure everything is in place and working effectively. So I then reviewed what we'd got in those half a dozen reports from around the country, and you get a number of key features there in terms of barriers, lack of clear information, low risk perception, lack of flood experience, the gaps in knowledge, the financial issues, infrastructure, rural settings, limited transport, community cohesion, a distrust in government, the issues with elderly or other vulnerable folk, the emotional stress and mental health issues, home ownership issues, and then the limited access to recovery grants. And from that, we can come up with, from the barrier type, some recommendations on remedial actions. And that was primarily improving the flood messaging, prioritizing flood resilience funding to the more deprived areas, improving the trust in government. And that's one area where perhaps the volunteer flood wardens can be a bridge. Prioritize the informing and assisting of the elderly and vulnerable, improving the mental health support, giving more support to renters and social housing, and improving access to recovery grants. So hopefully I've got that finished before the big bell goes. And there's some references there that you can work your way through. I recommend you look through the British Red Cross report. That's excellent. There's a web link there to that one.